Prioritization, delegation, and assignment. Guys, this is a very important topic on your Nclex. You are going to receive many questions that require your knowledge of this topic. That's why, guys, today I decided to have this special treat for you so that I can take you through how to answer questions related to this topic. And yes, you are going to receive many questions that require you to prioritize patients. You are given like 4 patients and they ask you which patient are you going to assess first. Delegation and assignment. What they want here is to know your time management skills. How do you use the personnel, the human resource on your healthcare team? Delegation, and which tasks can you delegate to who? Okay, assignment. What tasks are you going to assign to the RN, to the fellow RN, to the LPN, to the UAP? All this is very important, guys. If your desire is to know more about this topic, let's go through this together as you prepare for your Nclex exam. Let's get there soon. Okay guys, so today we are going to look at prioritization, which is actually deciding which needs or problems require immediate action and which ones could tolerate a delay in action until a later time because they are not urgent. This means you are going to be given problems, tasks. These tasks might be for one patient, or these tasks, and in most cases these tasks are going to be tasks for different patients. If these tasks are for one patient, you may have a situation like the patient has dysphagia and the patient also has ventricular fibrillation. Which task would you which problem would you solve first? Okay, which one would you prioritize of dysphagia and ventricular fibrillation? All these problems may be on different patients, and they will want to see which patient will you go to first. Okay, so guys, today we are going to learn skills and approaches on how to prioritize patient problems. Okay, so use the following skills to eliminate tasks and weigh competing tasks so that you can be able to answer the question correctly. The first question that you will ask yourself is it life-threatening if the task is not done? Also ask yourself, would another patient be endangered if this task is done now or the task is left for later? Is this task or process essential to patient or staff safety? Guys, as you can see, all these questions come back to one thing: safety. Safety is key on the Nclex, and the question that you should always ask yourself is, what would make the patient die if I did not do it? What would make the patient die if I did not do it? If you get that one task that would make the patient be in more trouble, if you do not do it, select that one. That is the priority task. Okay guys, so then other skills that you can use or other ways to eliminate other tasks and prioritize others are use airway, breathing, and circulation. You've heard about this almost, I can say, ancient way of prioritizing. ABCs, for instance, we know that the patient airway is very important and it's usually prioritized first, and then breathing next, and then circulation. However, sometimes we prioritize circulation. So you read the question very well and ask yourself and use the first skills that we have used. For instance, if I did not intervene in this situation, what would make the patient die very fast? For example, in the emergency room, you may want to, if you palpate the patient's pulse and it's absent, you want to begin CPR immediately. So circulation is prioritized before airway. But if the patient has been on the bed and they've been there, they have now been choked, okay, and they were eating something and then they became choked, you will want to prioritize airway. So really assess the situation and find out what are the circumstances in which I am using these ABCs. Okay? In other words, guys, it's not that airway always comes first. That's what I'm trying to emphasize. Then, guys, also use Maslow's hierarchy of needs. We know in Maslow's hierarchy of needs, there is what we call physiological needs, safety and security, love and belonging. So use that kind of hierarchy to see that physiological needs are always prioritized. Then, guys, this is also very important. Acute is prioritized over chronic. For example, if you are given with patients, one has COPD, chronic obstructive pulmonary disease, chronic heart failure, another has chronic heart failure, and another has acute abdomen or appendicitis, you will want to attend to a condition that is acute. For instance, this patient with acute abdomen, you will have to attend to him first before you attend to the patient with chronic obstructive pulmonary disease, because this is a chronic condition. We know this patient has been with the condition for some time. This patient may not die today because of that condition, but this one may die in a few hours if nothing is done. Then, guys, prioritize unstable over stable. If there is a word there in the question that's there are words that imply that the patient is unstable, that patient needs to be prioritized over the stable patient. Then, guys, fresh post-op beats other medical surgical cases. If the patient, for instance, is 1 hour from theater, came from theater in the last 1 hour, that patient has a lot of risks. Bleeding, that patient has another risk for a reaction to anesthetic drugs. So this patient really needs to be prioritized. However much there might be other urgent med-surg cases on your unit. So in that question, look for a fresh post-op. That one needs to be prioritized. Okay, guys, so let's talk about delegation, which is actually the process for a nurse to direct another person to performing nursing tasks and activities. Okay, so there are what we call the 5 rights of delegation. These ones help you in your decision making while doing your delegation as a nurse on your unit. And so one is the right circumstances. For example, the area where you are practicing, if it is for example emergency room and there is a nurse who has been floated in from a med-surg unit, would you really want to delegate critical tasks to such a nurse? If a nurse has, for example, home health care, acute care, long-term care, personnel in each of these units have different experiences and skills. So you have to make sure that you use them accordingly and appropriately. Identify where they best fit. Okay, but patient conditions and the preferred patient results must also be considered under the right circumstances. In other words, what are the patient's goals, and what are the preferred patient results. Okay, so all that must be considered in order for you to delegate. Then the right task, make sure that you delegate the right task. It has to be a task within that person's ability to do, and it has to be a task that is also within their scope of practice. It must be a task that they feel confident about doing. And then the right person, check that this is the person who is skilled enough to do what you want to delegate them to do. The right direction and communication on what to do and how to do it, and then the right supervision and evaluation. So as an RN, you have to supervise the delegatee, and also you have to evaluate whether the interventions, whether the delegation was successful. Okay, so what about assignment? Actually, this is very common on the Nclex. You will be asked, which of the following tasks would you assign to the unlicensed assistive personnel? Okay, so we are going to look through a few tasks that can be assigned to which person, so that on your Nclex you'll be able to choose the right task. So the NCSBN has a definition here. You can pause the video and you can write it down for your understanding, but I want to take you through what tasks are assigned to who. So for the RN, guys, for the RN, remember, is mostly concerned with the tasks that require judgment, that require evaluation, and the RN can never delegate the nursing process, can never assign the nursing process to anyone on the team except to a fellow RN. So the RN does clinical assessment. Do not delegate what requires assessment. The RN initial client education. The RN does discharge education, clinical judgment, and initial blood transfusion. And the LPN does monitoring RN findings, reinforcing education. Do they do education? No, but they can reinforce education that was already given to the patient by the RN. Routine procedures, procedures that you really know do not have any complication if this person, if this nurse did them. For example, catheterization. Okay, most medication administrations are done by the LPN, and ostomy care. Okay, tube patency and enteral feeding, specific assessments. Now these ones are limited to lung sounds, bowel sounds, and neurovascular checks. Okay, what about for the UAP? Activities of daily living, hygiene, linen change, routine, and stable vital signs, documenting input and output, positioning. Okay, all these ones can be done by the unlicensed assistive personnel. Watching up to this time means you are really very committed, and I wish you success in your upcoming exam. Yes, guys, you can make it. I made it, you can also make it. And if you find this video useful, please like it and click that red button below this video. Subscribe so that YouTube will be able to show you my future videos that I upload. Till next time, bye bye for now.